The study is presented by Dr. Ibrahim, lecturer at Al-Mustansiriyah University, College of Medicine, Department of Obstetrics and Gynecology, Iraqi, Baghdad. The title is Health Behavior Evaluation in Women with Multiple Pregnancies. The abstract objective of our study is to evaluate the effect of the health behavior in a pregnant with multiple pregnancies and which one had characteristic effect in those women. It is carried out in Alaa Hospital for a period of 1 year from July 2019 to July 2020. Our study included 40 pregnant women with multiple pregnancies, completed the 22 weeks gestational age with taking the verbal consent for the participation in this study. Selective questionnaire used to collect data and evaluate the health behaviors of recruited women. The results, the health behaviors rate was high, particularly for pregnant women with multiple pregnancy, as the health behaviors indicators were high among all the categories. We concluded that the higher health behavior rate in pregnant with multiple pregnancy in which the preventive behaviors had the highest rate. Introduction. One of the important subjects to bear in our mind the influencing effect of health behavior on the lifestyle of the human being because of the dependence of the pregnancy course, fetal development and the child development of the women's health throughout the duration of preconception and the pregnancy period. There is a significant proportion between the women's health and the other factors that lead to adverse pregnancy outcomes such as the lifestyle, like smoking, drinking alcohol during pregnancy, which increases the risk of preterm delivery and lower birth weight. Also, the physical environment, genetic rule, maternal obesity, gestational hypertension, gestational diabetes, deficient folic acid supplementation, which can result in the increasing risk of preeclampsia development, and cardiac defects, stillbirth, and orofacial defect. Actually, on the other hand, there is a negative relation between the women's health behavior and nutrition, such as lack of sleep, alcohol abuse, psychoactive medicine abuse, so that the pregnancy is regarded as the perfect time for the correction of this negative relation by changing the lifestyle of the pregnant women as well as the eating habit. Multiple pregnancy is regarded as one of the important subjects in obstetrics, as the pregnancy of the women with multiple pregnancy is considered as a high-risk pregnancy because it is associated with increased risk of obstetrical and neonatal complications. So our aim is to reduce these complications, especially the associated miscarriage, premature delivery, intrauterine growth retardation, higher incidence of nausea and vomiting, infant and neonatal mortality. Therefore, there is a need for preventive care, particularly the women's health behavior. Patients and methods. The study included 40 pregnant women with multiple pregnancies, recruitment of those throughout the period from June 2019 to June 2020 at Alaa Hospital in Baghdad. All of them completed their 22 weeks gestational age. The questionnaire survey used in this study, including the physical activity of women, social habits, coffee drinking, narcotics intake, as well as the taking hospitalization and reproductive histories. The HBI, which means the health-related behavior inventory, was used to evaluate the indicator of the health behavior, and that's called the Gynecology questionnaires, which consist of 24 questions about the health behavior according to these following factors. 1. Positive mental attitude. 2. Preventive behaviors. 3. Health practices like sleep and fitness activities. And 4. Proper nutritional habits, which means the types of food that the pregnant women had taken, like vegetables, fruit, whole wheat bread. The benefit of this is covering the women behaviors. 1, those who need medical recommendation, and 2, those behaviors that increases or decreases the disease risk, and 3, those behaviors that maintain health by using the 5-point scale as following. 1 means almost never, 2 means rare, 3 means from time to time, 4 means routinely, 5 means almost always. We asked the participants of our study group, according to this questionnaire, the assessing intensifies for each one of health behavior indicator, then ranging the scores between 24 to 120. The higher augmentation of the health behavior, then the scores classified depending on values and converted to standardized scores from 1 to 10, as 1 to 4 means low HBI, 5 to 6 scores means average, and 7 to 10 means high HBI. Questionnaire sheets were given for all enrolled women and the results recorded after reading and signing informed sheets. The results. Table 1 has showed that there was a higher rate of women health behaviors as the values for each indicator had been illustrated in this table clearly. And the health behaviors indicators were residence, level of education, maternal status, successful pregnancies number that were illustrated in table 2. And those indicators were all high in women with multiple pregnancy in all categories, and the preventive behaviors had the highest rate. The average age of the enrolled women in our study was 30 plus minus 4.4, as their age range from 24 to 45 years, and their gestational age, majority of women were from urban and areas, as the mean and standard deviation was 98.3 plus minus 10.30, and the remaining were from rural areas, as well as the majority of women were married with the mean and standard deviation of 95.3 plus minus 10.9, while others were single, 90.1 plus minus 11.9, with significant statistical difference as the p-value was 0.038. Most of our participants were in their second pregnancy, more than first pregnancy, as the mean and standard deviation was 99.4 plus minus 7.6 and 90.2 plus minus 10.4 respectively. More than half of pregnant participants were not having any physical activity before hospitalization. They got pregnant naturally, and few of them had undergone in vitro fertilization for pregnant. Current pregnancy was not the first. Discussion. The incidence of the multiple pregnancy increased over the last years, especially for the developed countries, as a result of increasing the assisted reproductive techniques with advanced age of women in her first pregnancy, ovulation induction without IVF, and all can lead to dramatic increase in the rate of dizygotic twins. Actually, most of the women in this study had got pregnancy naturally, 2%, and around 3.2% got pregnant by IVF. The multiple pregnancy is regarded as a high risk pregnancy, for that the pregnant woman needs frequent visits, and the frequent leading cause for hospitalization of those women was the premature uterine contraction in half of women, and 11 as a result of comorbidities like anemia, diabetes, and hypertension. Many studies consider the powerful relation between the neonatal health and the lifestyle of pregnant women during her pregnancy, particularly the physical activity and the eating habit, as they contributed in the reduction of back pain, which is common in pregnancy beside the excessive weight gain prevention. And unfortunately, the multiple pregnancy with its obstetric complications is considered as a contraindication to any excessive physical activity during pregnancy. In this study, our results had showed the higher rate of health behavior among pregnant women, as well as the higher rate of health behavior for the selected categories in those pregnant women with multiple pregnancy, as all the values were greater than 3.22 plus minus 0.45. There's a similar study. Jokinaskis et al. Found the same relation between the health behaviors and the high risk pregnancy in 61 women. Uh, Also, the health behavior was greater than seen in healthy women, as well as there were higher rates of positive mental attitudes and preventive behaviors. Also, there is another study by Bogiswecki et al. Found different results, as his study involved 268 control group healthy women and 214 pregnant women, as there was an average rate of women's health behaviors, and they found an average rate of health behaviors as the health practices and the positive mental attitudes was 3.68 with 3.69 respectively. We concluded from this study, our study found and highlighted about the health behaviors in pregnant women with multiple pregnancy beside the health behaviors indicators, as we found that they had a high rate, particularly the preventive behaviors, but the values were not dependent on the variables in this study. Thank you.